That puddle. It wasn't just water. It was a cocktail. A swirling mix of horse manure, human waste, factory runoff and death. And the people walking past it. They believed the smell was the killer. Welcome to the perilous world of Victorian healthcare. A world where the cure could be worse than the disease. Imagine cities bursting at the seams. Factories belched smoke. Millions crammed into crumbling tenements. Sanitation, often non-existent. Raw sewage flowed openly. Clean water was a luxury. This wasn't just dirt. It was a breeding ground for catastrophe. The Victorians faced relentless enemies: cholera, typhoid, tuberculosis, smallpox. But they misunderstood their foe. They feared miasma, poisonous air from rotting matter, germs, invisible, unimaginable. So they fought smells with perfume, not germs with soap. A fatal misconception. If you fell ill, what awaited you? Medicine was rooted in ancient ideas. The four humors: blood, phlegm, black bile, yellow bile. Sickness meant imbalance. The solution: often brutal intervention. First weapon: bloodletting. Bloodletting, draining the excess, was the cure-all. Fevers, headaches, inflammation. Bring out the leeches or the lancet. It weakened patients, sometimes fatally. Then came blistering, applying searing plasters or caustics to raise blisters, supposedly drawing out the bad humors through the skin. Agony, often for nothing. And then there was the golden age of quackery. Unregulated, dangerous, patent medicines flooded the market, promising miracles for cancer, syphilis, baldness. Their ingredients: often alcohol, opium, or deadly poisons like mercury and arsenic. Calomel, a mercury compound, poisoned countless, causing salivation, tooth loss, and neurological damage. Laudanum, opium dissolved in alcohol, silenced coughs and lives. But perhaps the most terrifying place was the operating theater. Before the 1840s, effective anesthesia didn't exist. Surgery was a brutal, agonizing spectacle. Patients were held down or given alcohol. Speed was the surgeon's only ally against shock and pain. Audiences watched, often horrified, sometimes fascinated. Imagine an amputation. The surgeon, perhaps famed for his speed like Robert Liston, would take mere seconds, 30 seconds to sever a leg. The screams were horrific. Infection was an accepted, terrifying reality. Tools weren't sterilized. Hands weren't washed. Germs, unseen, unknown. Surgical fever, gangrene and sepsis, killed nearly half of all major surgery patients. Then, a glimmer of mercy. In the 1840s and 50s, ether and later chloroform began to be used. The first painless operations were revolutionary. No more agonized screams. Surgery could be slower, more deliberate. But the shadow of infection still loomed large, untouched by the blessing of unconsciousness. Enter Joseph Lister, a surgeon haunted by the death toll. He read Louis Pasteur's work on germs causing decay. Could invisible organisms also cause surgical infections? In the 1860s, he pioneered antiseptic surgery. He used carbolic acid spray to kill germs in the air, on instruments, and on wounds. It smelled strongly, it irritated skin, but it worked. Lister faced fierce resistance. Established surgeons mocked the idea of invisible germs. His method seemed fussy, unnecessary, but the results were undeniable. Infection rates plummeted. Slowly, agonizingly slowly, antiseptic, and later aseptic, techniques transformed surgery from a death sentence into a life-saving art. The germ theory revolution had begun. While Lister fought germs in the operating room, Florence Nightingale waged war on filth and chaos in the wards. Appalled by the horrific conditions and death rates in military hospitals during the Crimean War, she imposed strict hygiene, fresh air, cleanliness, proper sanitation, good nutrition, and organization. She proved that meticulous nursing care saved lives. She became the mother of modern nursing. Back in London, cholera was a relentless killer. Physician John Snow didn't believe in miasma. During a devastating 1854 outbreak, he became a medical detective. He mapped the cases, the chilling pattern. Victims clustered around the Broad Street water pump. He convinced authorities to remove the handle. The outbreak slowed dramatically. Snow proved cholera was waterborne, not airborne, a landmark moment in epidemiology, even before germ theory was fully embraced. The proof was literally under their noses. In the sweltering summer of 1858, the Thames, choked with centuries of sewage, emitted the Great Stink. It was so overpowering it forced Parliament to act. Engineer Joseph Bazalgette designed and built London's revolutionary sewer system, a marvel of Victorian engineering, diverted waste away from the river and homes, drastically improving public health and proving the vital link between sanitation and disease prevention. For Victorian women, health challenges were immense. Childbirth was terrifyingly dangerous. Child fever, rampant infection, killed countless mothers. Doctors, often unfamiliar with female anatomy and resistant to hand washing, sometimes inadvertently spread the infection. Midwives often had more practical knowledge, but their status was low. Conditions like hysteria were vague diagnoses masking complex issues. Women endured pain and risk with limited understanding or control. For the destitute poor, falling ill meant the dreaded workhouse infirmary. Overcrowded, understaffed, filthy, and hopeless, it was a place of last resort, synonymous with neglect and despair. Disease spread rapidly. Survival was a grim lottery. Charity hospitals existed, but they too were often overwhelmed and primitive. For everyday ailments, Victorians relied heavily on home remedies passed down through generations. Herbal teas, poultices, rest, and broths were common first lines of defense. Books of household medicine were popular, but these remedies existed alongside, and were often overshadowed by, the dangerous allure of patent medicines promising quick fixes. Self-diagnosis and treatment were fraught with risk. Influenced profoundly by Florence Nightingale's principles, notes on nursing, and Lister's antiseptics, the very design and purpose of hospitals began to change. Pavilion-style hospitals, with separate wings for different diseases, maximized light and ventilation. Cleanliness became paramount. Trained nurses, following Nightingale's model, became essential caregivers, not just cleaners. Hospitals slowly evolved from places of dread to places of healing. The human cost was staggering. Infant mortality was heartbreakingly high. Many children never reached their 5th birthday. Average life expectancy hovered in the 40s, dragged down by these childhood deaths and infectious diseases. Surgery, even after anesthesia, remained perilous until antisepsis became standard. Disease was a constant, oppressive presence. Victorian healthcare was, for most, a terrifying gauntlet of suffering, ignorance, and dangerous remedies. Yet, paradoxically, this era of darkness forged the very foundations of modern medicine. The struggles against cholera and filth proved the paramount importance of public health and sanitation. The horrors of surgery birthed antisepsis and aspsis. The neglect of the sick gave rise to professional nursing. The persistence of pioneers like Snow, Nightingale, Lister, and Bazalgette established the power of evidence, observation, and scientific method over tradition and superstition. It's easy to look back with horror at the bloodletting and the filth, but understanding Victorian healthcare isn't just about shock. It's about appreciating the immense courage of patients who endured, the desperation that fueled dangerous experiments, and the visionary stubbornness of those who fought for change against overwhelming inertia. Their struggles directly shaped the medical safety and understanding we often take for granted today. So, what do you think? Could you have endured Victorian medicine? What shocked you the most? The public health nightmare, the brutal surgeries, or the poisonous cures? Let me know your thoughts in the comments below. If you found this journey into the foundations of modern medicine fascinating, give this video a thumbs up. It truly helps the channel grow. Don't forget to subscribe and hit the notification bell so you never miss our next deep dive into history's most pivotal and often surprising chapters. We uncover the stories that shaped our world. Thanks for watching. Check out more fascinating history on the channel. Until next time, stay curious, stay strong.